basis of empirical research, which almost entirely discounted everything that the promoters of the disease concept had been saying. The World Health Organization abandoned the disease concept and they moved to this idea that alcohol should be managed as a public health issue. And increasingly from the mid-70s onwards, through a lot of collaborative international research, they refined this approach, and the recommendations the WHO made to them from the mid-70s on have all been on this basis that there is strong evidence that alcohol will only be managed successfully if we start to think of it in public health terms. I've given you that reference at the end, which is one of the current ones, which I say a lot of people know already. Weber, and of course the significant thing is that they describe alcohol as no ordinary commodity. Apply the agent-host environment to the public health model. It says alcohol is no ordinary commodity, despite its legal status. Alcohol, and there's no real argument about this, it is an addictive drug. It's a drug that is toxic, so the more you consume, the more poisonous it is and the more damage it's going to do to you. And people who work in the drugs area, would probably be aware of this kind of paradox. We make such a song and dance about illegal drugs. And yet, a lot of the illegal drugs don't have the same toxicity as alcohol does. And of course, alcohol is an intoxicant. It makes you drunk. And if you're drunk, you're less capable of minding yourself. And if I was intoxicated this morning, which I'm not, I would be far more likely to fall off the list. So alcohol then is, as an agent, it is no ordinary commodity. It has all of these attributes which nobody really questions anymore. The public health model doesn't really have terrible mass on the idea of host. It doesn't really think that the hosting is too important. It's generally accepted that some of us are more vulnerable than others. There are some consumers who really do have great difficulty. But there are no consumers for whom the product is risk-free. Everybody who drinks alcohol, each host, is at risk. And finally, the public health model says, most significantly, it says that the environmental issues are key. Basically saying that a society that normalises alcohol as an everyday commodity, and that culturally and commercially makes it cheaper to purchase, more accessible, and in overall terms sees it as a very integral part of our culture, that is an environment that is going to experience an increased prevalence of a whole range of alcohol-related problems, not just a disease. So you're going to get a range of health problems and social problems, acute problems, chronic problems, all linked to this drug. When you come to how you might implement a public health model, of course, it gets a bit more complicated, because the model is universalist. It is not a targeted model. The disease concept was focused entirely on the unfortunate alcoholic. And other drinkers were regarded as, people who should be let, not interfered with in any way. But the public health model is universalist. It tackles all drinkers. It doesn't really have that kind of focus you would get from other models, like you're talking about subgroups, people who are alcoholics, or more vague phrases like alcohol misusers or alcohol abusers, or focusing on young drinkers, or focusing almost entirely on pregnant women who drink, or drink drivers, or whatever. It is focused on alcohol. It affects all drinkers. And the basic aim of the public health model, if it were to be implemented then, would be to reduce average consumption, or at least stabilise consumption, not let consumption go up. It's in the history of Ireland over the last 50 years, is that even though consumption has stabilised since we went into recession, the overall trend has been for a huge increase in drinking. This has been, as I'll say later on, the statistical material has been reviewed umpteen times. And the third point on that then about implementing the model is that, back to Dr. Snow, the public health model talks primarily about using control or regulation, using pricing measures, using legal restrictions on access, the number of outlets at which alcohol can be published, the opening hours during the licensing laws, and the hours during which alcohol can be purchased in, say, off-license, whatever. And also, to a lesser extent then, on the way in which the product is marketed, advertised, promoted to its consumers. Now, there are difficulties with implementing this. Even though the evidence base is strong, the reality is that public policy making is political, not essentially rational logic. I don't suppose anymore that anyone really has that kind of fantasy that public policy making is an entirely rational or evidence-based process, and that you have ministers sitting at their desks waiting for the next raft of research material to be dropped on them so they know what to do. Policymakers, and at the highest level in democratic systems, we're talking about government ministers, duty ministers, they have to adjudicate between conflicting and competing value systems, and they do this in relation to alcohol. That the evidence that is presented, and even though the evidence is very strong and very compelling, that there is other evidence available to politicians, to senior policymakers. And in many cases, the evidence is what happens when you go home for the weekend and you're doing your clinics back in your own constituency. What is the public view? So policymakers have to weigh that research evidence against what I call here the national mood when it comes to contemplating any potential policy measure. What do the grassroots think about this? And today I think you are the grassroots. If we look at the value systems in a kind of abstract way, neoliberal values are dominant across the globe at the moment since the fall of the Soviet Union in 1989. There's not an awful lot of competition. And one of the key neoliberal values is one about consumer sovereignty. That talks about the market, and essentially it says that individual citizens are best placed to know what they want, to know what is good for them. They must be sovereign, they must have that basic right to make choices, consumption choices themselves, and that states shouldn't unduly interfere with these kind of consumption choices. So you can see Dr. Snow wouldn't have done well there.